Welcome everyone to the fourth and last episode of our webinar series on the EU privacy response to COVID-19 with our experts from Belgium, Switzerland and Germany. Today we will explore with them which can be the possible further steps to be taken in response to COVID-19 in each country. And I would like immediately to start discussing about this very interesting topic with Geert. Geert, which may be the next response to COVID-19 in Belgium, and what would you advise supranational authorities and organizations to do?
Well, in Belgium, I would expect that our government will keep taking a pragmatic and professional approach, which they have been taking so far. We actually we received very positive feedback from other countries. It was in the Financial Times for the way we are dealing with the crisis. For example, at an early stage, there was a daily press conference already at 11 o'clock, which we keep doing to inform the public, which is quite impressive for a country that's been without a real government for about a year and a half now. So I must say it's quite interesting how we manage that. From a more supranational level, as you were asking, it's a bit more complicated, of course. The European Union is not competent for health-related matters. It's something where we see the challenges now. Countries have to respond quickly. They have different visions, different challenges also, depending on how heavily they are affected. So they move on. They don't really have the luxury to wait for a coordinated approach at European level. Which brings me then probably to the point of how are we going to deal with that in the future? And the key word there is emergency preparedness. How are we going to be better prepared, prevent, and be able to deal with a crisis like this, or even a catastrophe, as some people call it, before Corona and after Corona, BC, AC, in the future. I think what's probably interesting is to look at how non-governmental organizations are dealing with this. If you look, for example, at an organization like Doctors Without Borders, Médecins Sans Frontières, they have emergency preparedness in their DNA. They've had it in their DNA for many years. They're used to dealing with outbreaks. They have a logistics ready, etc. So governments and non-governmental organizations may want to talk together to be better prepared for these emergencies. And maybe to add something also from a data protection point of view, because after all, that's also why we are in this fantastic alliance, is that, well, over time, we will need to learn from this, and we will have to see also there how we can apply all these great principles that we've been talking about to such emergency situations, while we already thought about it in advance. So for now, there is leniency from the data protection authorities because no one of us is used to this situation. But for the future, I think they will be more strict because everyone will be considered to be prepared in advance.
Perfect. Thank you very much for your view, Geert. I would like now to move to you, Volker. What about Germany?
Well, I think nobody really thought about COVID-19 the last years, or that something like this could happen. But what of course governments and organizations thought about, and this is an output, is the so-called IT security law in Germany, that you of course define like critical infrastructures and certain IT security measures and duties apply to these businesses. So might it be a hospital, might it be airports, infrastructure as such. Their special IT security, business continuity duties apply. And I might think that this definition of critical infrastructure might be reviewed in the coming month or so, because that's what I realized, that of course when you think about these laws that do not allow people to leave houses, that you cannot continue with your business. you want to be critical infrastructure in that moment to do and gain revenue. And I think this is an important area where we might see changes in the future. I also think that businesses as such should think about emergency plans more with attention in the future as they did that in the past.
Perfect, Volker. Thank you very much. And Gabriel, which may be the next step in Switzerland, and what would you advise to supranational authorities and organizations?
So I think there are, in terms of the response today, there are several phases, and just before it will end, we are now seeing increase in hospitals, and that's what's triggering the most debate. And there's going to be the phase of obviously, and it's now already happening for clinical trials. So I would expect some guidance specifically for a patient applying to those clinical trials. There's been already some guidance, such as the EMA, the European Medicine Agency, providing thoughts on COVID-19. I would expect, generally speaking, after it's ended, to learn lessons. Also, because I think many businesses, as it's been said already by my colleagues, they were not ready. Nobody could expect what is happening today. And the lessons would be, I think, just to adapt to a crisis. How can we prepare, at least with minimal, governance around, how we can handle the situation? Basically, just with digital. There is a lot of discussion about using telemedicine, about using digital health application, about a lot of things to use in today to that context, but just in a rush mode. And I think we will have to learn on having something ready for the future. Also, I would be interesting to see, because data breaches will happen, and there's also been a cyber attack in a hospital in France, which is very unfortunate and extremely hard to receive that kind of attack during that moment where it's about lives, not about just data. So I would be interested to see how authorities would give guidance around how to handle and be kind of okay to not be 100% perfect with privacy practices during a crisis moment. That would be very interesting to see guidance around that. And for the rest, I think just stay home and keep calm.
Perfect, Gabriel. Yes, we definitely have to follow that indications. And I can see that Volker would like to add something. So please, Volker, what would you like to share with us?
Yes, or maybe to give an example, in Germany, a reaction to COVID-19 from the government, for instance, is a change in the law that might also already apply in April, that general assemblies for companies can be virtual and must not be, as today, must held in person. So this is, I think, a good example for as a reaction for the problems we can't meet in person at the moment, and maybe not for a couple of weeks or months. And that's kind of, I think, a good example for that.
Thank you very much, Volker, for your view, and to you all for your different point of views. This was our last episode on how European countries are facing COVID-19 with a focus to data privacy. And I hope you find it interesting, and I hope you will keep following PrivacyRules, also because PrivacyRules just created a COVID-19 international response team that will keep you updated on what's happening, and that is ready to help you for each issues related to COVID, not only on data privacy, but in general. So I thank you all for listening to us. I thank our speakers for joining us, and I hope to see you all very, very soon again. Thank you.